Hospitals may have the expertise to save your life, but unless you're VIP, that doesn't mean that every member of your care team has unlimited time to explain what is happening to you. So this doctor, enters your room, and listen, that doctor has a long list of patients waiting. And you got this nurse who's answering your questions, and that nurse is already overworked because they're giving medication and responding to alarms, coordinating tests, documenting care, and preparing for another patient for discharge. There's a lot going on, right? Then, depending on the type of care that you receive, you may have a specialist, and then this specialist spend 5 minutes with their whole team at your bedside, reviewing your chart and your lab results and your imaging, but you never saw what happened. And no one sits beside your bed and they say, we may only have a few minutes together, so let's make sure we use them well. Can you imagine if that happened? But no, what happens is, someone walks into your room and they'll ask, hey, how you feeling? They examine you, they explain part of the plan, and it's like, all right, I'm out. And it's like before you can even process what they said, here comes someone else asking a different question or talking about a new medication or whatever. It feels rushed, right? And you feel invisible, maybe at times unimportant. You know, um, but the uncomfortable truth is that the moment of time someone spends standing beside your bed is not always the same as the amount of work being done on your care. Um, and there's this finding that hospital clinicians usually spend a substantial time on indirect patient care, which is reviewing your records, entering orders, coordinating with other professionals, and documenting decisions. And these time motion studies have found that hospitalists spend a smaller portion of their workday in direct contact with patients than they spend performing indirect care activities. Isn't that very telling? You know? Um, and I just want you to understand. I really want you to think about that. I want you to understand, this is the hospital system. Okay. And so when that time that you have with these professionals is limited, clarity cannot be left to chance. So today I'm going to explain what hospitals rarely tell you about how time works inside inpatient care and how you can get the information you need without feeling as though you have to chase everyone down the hallway. So buckle up and let's do this. All right, point one. The hospital does not run on your clock unless you're VIP, but it doesn't run on your clock. So when you're lying in this hospital bed, your day revolves around your health, right? Because you're waiting. You're waiting for doctors, you're waiting for results, and you're waiting for imaging. You're waiting to eat, and you're waiting to learn, whether you can go home and just wait for someone to just tell you what's happening next. And an hour can feel like days. Okay. But on the other side, the hospital is operating on a different clock. Okay. That physician that was assigned to you is reviewing other patients at once, maybe two or three. It could be all in the same room. Who knows? But the physician is reviewing other patients. All right. And then the nurse that's assigned to you is more than likely assigned to a multitude of people who have different medications, different risks, different needs. These labs in these hospitals are processing thousands of specimens. You have a radiologist for imaging, They're interpreting all types of images from the hospital, the pharmacy, over here authorizing and verifying medication orders. And if you got a case manager, they may be trying to arrange equipment, rehab, transportation follow up, all those things. And so you experience that your care, one delay at a time. Okay. And the hospital experiences that those delays as hundreds of tasks moving through one interconnected system. Right. So there's you, and then it's like this cloud of chaos over here, and they're just trying to piece everything together. All right. So I want to give you that perspective. Okay. Um, And so while you're laying there, you're just like, oh my gosh, because there's nothing on TV. You're uncomfortable in the bed. You may even be hungry. And you got this gown and little socks, and you're just like, oh my goodness, no one has come back. And, your team, on the other hand, is just over here. They're waiting for information needed to make the next decision, right? So both of these experiences are happening simultaneously, okay? And, I speak from personal experience. Um, I've been in a hospital setting um, a few times, and I know what it's like waiting, and you're just waiting for. In my case, I was waiting for biopsy results and lab results, and I wanted to hear about my kidney function. I named my kidney Kidneysha, so I just wanted to know how Kidneysha is doing, and all these questions are coming up, right? And you don't really care, or you're not thinking about all these other people and what's going on, and or what the patient, or I mean the physician, needs to see, or what the nurses are doing and so forth. All you're thinking about is, hey, or I can say all I was thinking about was, is my kidney okay? Why these numbers changed? And is my treatment working? When am I going home? When can I eat? What if it gets worse? How long am I going to be here? Am I stuck here? So of course, when someone enters my room, when they're using their little medical jargon, and then they leave before I've even formulated a question, it's just like, well, damn. It just feels like the system does not understand what's at stake, right? And so, one thing that I've learned in my experiences in these hospital settings is that, okay, I have no control over how many patients my physician had. I can't control when these labs become available. I can't control the hospital workflow. I'm not VIP. And, you know, but what I realized is that I could become more intentional about the moments when someone was standing in front of me. And, I realized at that point is that I could change how I communicated during my hospital stays. All right. Now, this bedside time is only part of your care. All right. Um, I get it that you may judge the quality of your hospital care by how long the physician remains in your room. I get it because that's the part that you see. But a lot of the hospital medicine happens outside of your room. And that's why you're hooked up to all these machines. They're monitoring you, they're looking for trends, and they're looking at the lab results and imaging reports and notes and nursing concerns, your fluid intake, just how you respond to your treatment and all of these things. And so, they're leaving your room, and they're collecting all this data, and they're placing orders, they're making phone calls, they're talking to the pharmacist, they're reviewing tests, updating your care plan, doing all the things. They're communicating with nursing staff, and maybe even coordinating your discharge. And that work still counts as time spent on your care, even though you were not present for it. All right. And so a brief bedside visit does not automatically mean that no one is thinking about you, but it also does not excuse leaving you without a basic understanding of the plan. Now, the goal should not be to demand that every clinician remains in the room indefinitely. It should just be, your goal should be to make that available time more useful. So capitalize on that bedside time. Okay, I'm going to get into that too. And depending on your condition, you may not have just one doctor. Um, and I think a lot of people feel that when they go to these hospitals and so forth, that they're only assigned, one person, and one person is overseeing every detail of your care. Usually these hospitals, because usually they're teaching hospitals. So, you have your attending and you have a resident, fellow, specialist, a physician assistant, a bedside nurse, a case manager, social worker, therapist. You have the whole gamut, right? And each of these individuals see a different part of your picture. And sometimes that team based approach can be valuable, right? But of course, you're just like, well, dang, who is in charge and who makes the final decision? And excuse me, who should I ask about going home? You know? And so I think it's important to understand the roles of the people who are coming in and out of your room, because you may, repeatedly ask a question that should be directed to someone else. Um, and they may not be authorized or prepared to answer. So, it is important to know who's who, and the why, and just to help you just get a better understanding of what it is they're looking for. And so, what you can do once people start coming in, sometimes they'll write the doctor's names and the nurses on a board, but you can still ask anyways, just so that it gives you even more clarity. You can ask, "Hey, who is the main physician responsible for my care today?" Or ask, "Which team is making the final decisions?" My favorite, "Who is the best person to ask about medications?" And then another favorite of mine is, "Who is coordinating my discharge?" And I think that those type of questions help navigate the structure of your stay instead of guessing. Um, and keep in mind that the person that you spoke to previously, they may be leaving. Folks have work schedules. Even though hospitals, they operate on the clock. Um, your care doesn't stop at 5. Um, so keep in mind that the people change. The people who are caring for you change because shifts, nurses in their shifts, these physicians are on rotations, their weekend teams, their residents may change services. You, the patient, may move in between units. And so every transition requires information to be transferred from one professional to another. They call this a handoff, right? And in some cases, handoffs are necessary, but they also vulnerable moments, because these transitions between clinicians and hospital units create opportunities for information to be delayed, or even misunderstood or even omitted. And that's why you may tell one person something in the morning and discover in the evening that that team doesn't even know anything about it. Um, it is not because no one cared. It's just that that information may not have traveled as clearly as it should have. But this is where you and your loved ones, or whoever's there with you, could helpfully close that loop. Because when a new nurse or a new physician introduces themselves, just briefly restate the most important issues. Just be like, "Hey, my main concerns today is the new shortness of breath that started overnight." Or just be like, "You know what? We're waiting for the specialist to review the scan." Or, "Hey, listen, I was told that this medication, I was told not to take this medication until someone checks my kidney function," or, whatever. Um, and you're not trying to, boss them around or run a medical team. You're just making sure that the most important information remains visible during the transition. And if they say, yes, we know, that's fine, because I'd rather you tell them 1,000 times than not. Because you got to stay on top of things. Because, like I previously mentioned, these folks out here seeing, other patients, and they're juggling all of their tasks as well. So, yeah. Now, I want you to capitalize on these rounds, okay? Because rounds may be your best opportunity. And in many hospitals, um, usually, I would say really productive conversations of the day happens during your rounds. And what are rounds? So the rounds are when the physicians or a medical team reviews your condition and then discuss your plan. But the problem is we patients don't always know when the rounds will happen. You know what I'm saying? You could be sleeping, you're in the bathroom, talking to someone else, um, and then come in and then come and go. So what you can do to stay on top of things is you can ask your nurse, do you know approximately when the next medical team usually round? That just gives you a little time frame. It may not be exact because the schedules constantly change, but it's important. I think that having that general window can help you prepare. And, that gives you the opportunity to write down some questions, maybe like three to five. Um, and so I think when you're trying to figure out some of the questions, I think you should ask something along the lines of, what's the main problem you're treating today? What are we waiting for right now? What needs to happen before I can safely go home? Maybe ask that one first. So, yeah. And then that time is limited. So when time is limited, stop beginning with the entire story. You don't necessarily have to begin with every detail in chronological order. I get it that you want your clinician to understand the full story, but remember, you're in a hospital. So there is a possibility that the person in front of you has already reviewed much of that history. So I want you to start with your current concern. So instead of just talking about, 3 years ago, this happened, and then last month, something similar happened, and then yesterday, my cousin told me, nah, start with this. My main concern is that the pain became significantly worse overnight, and then give the relevant details. Relevant details such as, where is this pain located? How severe is it? What else happened? Have you tried anything? You share what you've tried. Now remember, I'm not trying to get you to silence yourself. But, I want you to make sure, just because of the hospital setting is completely different than the doctor's office. And I just want to make sure that that making the most important information available, making sure that is heard before the conversation ends, your reason for being in the hospital. Okay, that's what you want to provide. And then I want you to ask for the plan in one sentence. Because hospital care is complicated, right? You get all these explanations, different stories from the nurse and specialist, and, all of these things. So I want you to ask them, can you summarize today's plan in one or two sentences? You don't need all these paragraphs and stuff like that, because are you going to remember all of that? No, you're not. And I think just asking for the summary, and they give you something like, listen, we're treating this infection. We're monitoring XYZ. We're waiting for these blood cultures before deciding whether you can switch to oral medication. Boom. Now you have a framework. And, every new test or medication can be connected to that plan. Because without that framework, a day feels like a series of unrelated interruptions. Okay. Ask what they are waiting for, because you already know that a large part of hospitalization is waiting. you know. But we aren't told what we're waiting for or what everyone is waiting for. Usually we're not. And so just ask, like, you know what information do you still need before making the next decision? Just to quell some of that anxiety. And, it could be something like a lab result or imaging result or the specialist recommendation. Maybe they're waiting for a period of stable vital signs. So they want to see if you're able to eat or walk or urinate safely. No, or insurance authorization. Lord have mercy. Those things. Um, or placement in a rehab. And I think that once you know what the team is waiting for, that delay then becomes easier to understand. Sure, you feel frustrated, but uncertainty is definitely less stressful than a delay, right? Yeah. So when a professional tells you, I'll come back, that more than likely doesn't mean soon. Because you hear a professional saying something like, I'll return in a few minutes, that means they're going to see other patients, maybe review your results, speak to other physicians, possibly respond to an urgent situation, and just finish all these other several time sensitive tasks. And so that I'll be back could be much later. And so what you should do is ask for a realistic expectation. So should I expect you back within the next hour or later today? Or is there someone else I should ask if you're unavailable? Or you can even ask, what should I do if I have not heard anything by this afternoon? You're just asking for a communication plan, point blank. Okay. Um, I want to just talk about this one briefly. So this one I feel is a little controversial. And this is about the loudest patient should not receive the best care. And I think that there are some patients out there who learn that these repeated calls and these demands and these escalations produce faster responses. That creates a terrible dynamic. Um, the loudest person may receive attention while the quietest patient waits, but being an efficient advocate does not require becoming hostile. You can be clear, you can be persistent and respectful, right? But you ain't got to be obnoxious either. So try something like, look, I understand that the team is busy. I need help understanding whether this symptom has been communicated to the physician. Or, I'm not waiting or I'm not asking for an immediate final answer. I just need confirmation that someone has received that concern. Something along those lines. I think that type of language, it identifies the gap without attacking the person in front of you. Because they're human too. They like I mentioned before, they're overworked and they're seeing about all these other tasks. And you know, be nice. And so, but you can actually use your nurse as a communication partner. I think that your bedside nurse is often the person who sees the changes that occur between the physician visits. They may observe things like changes in your pain and bleeding, your medication. They may notice any confusion or weakness in your symptoms. And, they also communicate with your medical team throughout the day. But, your nurse can't always answer questions that require a physician's diagnosis or a treatment decision. So instead of just asking, okay, when's the doctor coming? When is the doctor coming? Oh my gosh, when is the doctor coming? Try, could you help me communicate these two concerns to the medical team? And then state whatever those concerns are clearly. Or you can ask, what is the best way to make sure this question reaches the team? Is there anything I should write down for rounds? Or, has the physician been updated about this change? remember, you are part of the communication process. It is you, and what these things are happening to you. So, yes, it's important for you to play a role in your care. And if you can, bring someone into the conversation, if you can, because, so much is going on. You could be in pain, you could be tired, afraid. Some of these medications may make you drowsy, and you're processing all of this information. You're hearing all these words, and you're not retaining anything. So, if you can, involve a trusted person. And then that way, that person can be physically present or join by phone or participate through video. So before the conversation, I want you to decide what you need that person to do. Either listen or take notes, ask follow up questions, remember the medication changes or confirm the discharge plans. I don't want you to assume, I want them to know, I want you to be crystal clear with the expectation. So say something like, I need you to write down the plan and anything I need to do after the discharge, because that turns into practical help. All right. And also, I want you to use teach back. All right. And this right here will help you understand the plan a lot clearer. So you can just say something like, let me make sure I understood. And then you explain what you believe is happening. So let me give you an example. So say something along the lines of, okay, so my understanding is that the scan did not show an emergency, but you're keeping me overnight because my lab results are still changing. But if they stabilize, we'll discuss discharge tomorrow. Is that correct? And then that gives the clinician or whoever's on your medical team an opportunity to correct anything that you may have misunderstood. It's not a test of your intelligence, it's a test of whether the explanation was clear. Now, you can write down names and roles. I mentioned before that sometimes your medical team may write the names on the whiteboard. I think sometimes it's also important, to remember who said what. So if you can, keep a simple note with the person's name, their role, the date, the main update, and the next step. You don't have to necessarily document every word, but you can say something like Dr. Jones, hospitalist, waiting for labs. Uh, Maria, case manager, arranging home medication. Cardiology team, reviewing heart monitor. And I think once you have noted all of that, this will help you ask better questions later. Instead of saying, well, some doctor told me I might leave. You can say something like, oh, okay, well, the cardiology team said this morning that discharge might be possible after the monitor is reviewed. Has that happened? And I think that specific communication is easier to act on. So, and another thing I want to add is discharge often starts before you know it. Um, and, a lot of us usually think that discharge planning begins when the physician says, you can go home. But no, listen, real talk. The process may begin much earlier because, your team is providing feedback, whether you can walk safely, whether you need help, if you can get your drugs, if there's equipment needed, follow-ups, all of these plans have already been discussed. Um, so it's not sudden, but to you, it may feel that way because one moment you're waiting and the next someone hands you several pages and says, all right, you're leaving. But I don't want you to wait until transportation arrives to ask questions. I want you to ask early. What needs to happen before I can be discharged? What might delay the discharge? Will I need help, medication, or equipment at home? Who will manage the problem after I leave? And my favorite, when should I follow up? All right. And When we're talking about discharge, I want you to understand that the discharge conversation may be the most important one. I know at that point you're ready to go, you're tired, because you really haven't gotten sleep because of the interruptions and it's hospital food. So you're ready to go home. You want the comforts of your own home. But this is exactly when important information may be rushed. So before leaving, I want to make sure that you understand why you were hospitalized, what diagnosis was made, or whether the diagnosis remains uncertain, which medications changed, which medications stopped, what symptoms should prompt a phone call, what symptoms require emergency care. I want you to find out if there are any pending tests, who you will contact about these pending results, find out what appointments you need, who's responsible for arranging them, and ask for the plan, right? And don't leave simply because someone handed you paperwork. I want you to leave when you understand what the paperwork is telling you to do. Got it? Okay. Now, with these pending results, ask about the pending results because some results may not be available before the discharge, like cultures, these specialized lab tests, final imaging interpretation. So, ask, if there are results pending, who's going to review them, how you're going to be notified, what should you do if you don't hear anything. A pending result should have an owner, and you should know who is responsible for closing that loop. Okay. Now, uh, this is my opinion on what I think hospitals should do better because, you know, we patients should not have to become communication experts simply to understand our care. I think that hospitals can also improve this experience. I think it would be really helpful to provide visible names and roles for the care team. Like I mentioned, some hospitals do write the names on the health on a whiteboard. Sometimes folks fall off of that. I get it, things happen, but just to consistently do that would be very helpful. I think it would be very helpful to have predictable rounding windows when possible and daily written goals, bedside handoffs, a clear explanation of delays, realistic response expectations, clear terms, simple terms with the discharge summaries, a designated contact for unresolved questions, confirmation that patient concerns have been received. Better communication does not always require a 30-minute bedside conversation. Sometimes it's just one sentence. We have not forgotten about you. We're waiting for the scan to be interpreted, and we expect to update you this afternoon. Boom. And that sentence right there reduces hours of anxiety. You know, communication is not an optional courtesy, it's part of safe care. And one of the reasons that I built Alvora Health is that a lot of patients receive an enormous amount of information during these hospital stays. I've mentioned lab results, imaging results, medications, discharge summaries, follow up instruction, all this medical terminology. And when a lot of it arrives to you, you're exhausted and you're afraid, or shoot, you're just trying to go home. And Alvora Health is a healthcare clarity companion. It's not your physician. It doesn't diagnose you, and it does not decide what treatment you should receive. It helps you better understand the health information you already have, and you can review lab reports in, more trauma informed, more simple terms. And it helps you organize questions for the medical team, and it helps you prepare for discharge conversations and to help you better understand documents that you receive after hospitalization. Because the time you have with your clinicians is limited. And so your ability to prepare and understand shouldn't be. In hospitals, Never begin your stay by telling you exactly how many minutes each person has available for you, because there is no universal bedside timer, and different patients require different amounts of care. And a medical emergency can change the entire day. Um, and a physician, unfortunately, may spend less time in your room because your condition is stable, or they may spend more time outside your room coordinating something complex. But my point is that not every clinician is secretly counting down the seconds. My point is that hospital care operates under real limits: time, staffing, workflow, emergencies, transitions, documentation, and competing responsibilities, emergencies. And so when we, the patients, don't understand these constraints, limited communication can feel like limited concern. But those aren't the same thing. But compassion without clarity still leave a lot of us confused, and excellent medical decisions that are never properly explained can still leave people frightened and unprepared. Excuse me. And so you deserve to know who's responsible for your care, what the plan is, what the team is waiting for, what needs to happen next, and what you must do after leaving. And I don't want you to measure your care only by the number of minutes someone stands beside your bed. I want you to measure it by whether the team hears you, they hear your concerns, and they communicate the plan, and they safely close the loop. So the next time you or someone you love is hospitalized, write down these 5 questions. Who is leading my care today? What is the main problem you are treating? What are we waiting for right now? What needs to happen before I can safely leave? And lastly, who should I contact if I still have questions after discharge? Keep those questions beside the bed and ask them during rounds. Use them when the team changes, and repeat the answers back in your own words to make sure you fully understand. Now, you don't need to become a healthcare professional, but you need enough clarity to participate in your care. And so, for help understanding common lab tests and preparing better questions, download my free Clear Lab guide using the link in the description. Because better conversations begin with better understanding, and better clarity leads to better understanding. And the next thing I'm going to talk about is the real reason your lab results are so confusing. So buckle up.